been a minute, but I just want to get straight into the video. I know where y'all came here, so if you're approaching nursing school, want to know what it's all about, stay tuned for this video. If you're new to my channel, welcome. Be sure to subscribe if you're one of my loyal subscribers. Hey y'all, it's been a minute, but I promise the content to come will be worth it. And so the first thing I want to tell y'all about is how was my clinical in labor and delivery. So many of us, or just say if you're a nursing student or whatever, look forward to the clinical in labor and delivery, want to know what it's like, or in general, if you're just starting off nursing school, just starting off, or just beginning your journey, what is it like, yada yada yada. If you have more questions, you can just list them below, or you can go check out some of my other freaking videos that I answered those questions in. I just randomly decided to film in what used to be my old bedroom, but now just like an extra bedroom. So hence my purse, hence the stuffed animals, but hey, who cares? All right, so a typical, well, let me say, so this semester, if you didn't know, I took Gero in the Gero clinical, I took OB, the OB clinical, and then I took a master's level class called evidence-based practice. So first starting with the good and the good, which was OB. Typical day on OB, my clinical was from 1 to 7, and so on 1 to 7 on Thursdays. When I got to clinical, we would get our assignments. So basically get a handoff from your teacher. So you'll have a room, tell you a little bit about the patient, get your G's and P's. If you do go to nursing school and take OB, which you will, but you'll learn what G's and P's are. It's just gravida and par. Gravida is just how many times the person has been pregnant, and then P is how many preterms birth. So fun fact. Nursing students be like, so anyways, we would get that. We started off in labor and delivery, and then we went to start off with labor and delivery, went to postpartum, and then we went to the well baby nursery. And like a few of us, it's kind of a glare, y'all, I'm sorry, but let me make sure I'm in focus, y'all. But just deal with it, you feel me? So labor and delivery had to be my favorite. So after we got our handoff, we would go on the chart, and get our patient information, and you would introduce yourself to your patient, introduce yourself to your nurse, and all of that. And so meanwhile, in labor and delivery, we always had to do something called fetal heart rate monitoring, which is honestly just making sure that the baby is okay. And we had to do that every 30 minutes, but the nurses have to do it like Q15. It just depends on what they're on, the different medications they're on. So it was so fun because there was always something to do. And on my first day, I got to help like with my first delivery, and I was like literally there. It was only the nurse and myself, and y'all, I was, you know, because of HIPAA, I can't, you know, disclose too much information, but I was like, I got to see on my first day of OB clinical, y'all, like it was it's so different than watching a video on YouTube, watching a video on social media, or what's it called? I don't know if y'all remember, but a baby story. So much different in it, because being in the moment, y'all, I almost passed out, but I had to keep it together for my patient. But you know, I had one leg and like push. So that was probably the best part. I got to see lots of deliveries, lots of C-sections. I mean, that's a lot. Lots of vaginal deliveries. Only one C-section, and y'all, my C-section that I seen, the baby did not come out alive. So it was, y'all, that's I don't know, it's just something to look forward to. Like labor and delivery was the spot. The nurses were oh so sweet. We went to postpartum. So postpartum is more focused on the woman, will focus on the mother. You're not focused on the baby, like that isn't your concern. And so you want to know, what are you doing postpartum? The main thing is making sure that the uterus, another nursing students be like, is involuting. And so just moving back down, because you know, at first, y'all, I'm like trying to get comfortable and not look like a box, but it's really this shirt. So forgive me. Anyway, and I have like a going on. Sidetrack. So you're checking for bleeding, you know, hemorrhoids. Maybe one day in nursing school you will learn something called the bubble heat, where you're checking the breast, the uterus, the bowel, the bladder, the lochia, which is like her bleeding, and then her episiotomy. Sometimes you may hear people talking about they tore. It's like a vaginal tear, and you know, they're graded based on their degree, and it's 4 different degrees. So I said episiotomy. It's an episiotomy. Forget whatever I said. Episiotomy. And so you're just assessing the well-being of the mother. And then we went to the well baby nursery, which is focused on the baby and evaluating the baby, doing things which you will learn if you haven't taken, but you'll learn about the APGAR and just doing like a head-to-toe assessment on the baby, which is so different than doing a head-to-toe assessment on a adult or a mother. So that was nice, and I got to hold little newborns and rock them, and just, yeah, it was like the full freaking experience. I don't know, like, I don't want to talk too much, but if y'all have like specific questions and want me to get like into detail without violating HIPAA, I can, because y'all, it's really something to freaking look forward to. My favorite again was labor and delivery, and I really like the well baby nursery too. My least favorite probably was postpartum, simply because we work with the mother and I work with adults all the time. So that was that. For gero clinical, how was it? Geriatrics, it wasn't bad. I had very, very sweet patients. The 2 nurses that we worked with, they were sweet, you know, wanted us to learn. But I mean, it's not a place that I would, not the particular place that I had my clinical at, but it's not a place that I just, a field that I want to work in. Geriatrics, I mean, it was cool, it was yada yada, I did awesome in the class, but it's like, okay. And then I had evidence-based practice. I'm not going to speak on that. I did very, very well in that class, not to know anything that was going on, but it's basically concerned with research in nursing, and again, evidence-based practice to, you know, better outcomes in different hospitals or healthcare settings. So you use like qualitative data, quantitative data, all that stuff. PhD, real master's level course at a BSN level, all of that. Yeah, I'm trying not to be too freaking winded, but for me, I wish I just had somebody to just talk to about, you know, nursing school and all that jazz. I think that's all that, but y'all, I had all B's this semester, so woo woo out of here. If you are in nursing school and you know the struggle, the mother struggle, that is good. Y'all, I don't like how this angle is freaking looking like, I don't know. So I have a video that was, I never edited, and it just talks about how my 3rd semester was going, that I'm gonna post after this, which is actually, yeah, that I'll post after this. So if you want to see my mental space then and then now, but it's just content that I needed. I didn't get a chance to post, but I'm going to post. Overall, 3rd semester, it wasn't bad at all. You definitely had a lot more free time, but you didn't have a lot more free time. The free time that you had to freaking study, and it was a heck of a lot of paperwork, like a ridiculous amount. Care plan all the time. And so, but 3rd semester, overall, it wasn't too bad. 2nd semester definitely was way worse. I feel like if you can make it through 2nd semester, you can make it. So I just wanted to update you guys. I seriously plan on being consistent. I don't know what you guys really want to see, but I'm not like trying to copy off of nobody, be like anybody. So, but I do have a lot of life experiences. I know a lot about nursing school and like natural hair, like, and I keep saying like, dang, sorry, sidetrack. So I just wanted to, what do you guys want to see? I know, like, I have different ideas about what I want to put out, but, and let me tell you this, I do want to try the spicy noodle challenge, y'all. I really, really do. But other than that, like, I don't do wigs, weave, hair, and I really need one of those. I need a wig made. I got a wig sitting right here, but dang, it's too little because the girl didn't measure my mother freaking head. So I need a wig. If you're in the Memphis area, please. I hope this video wasn't all over the place. Nursing school third semester, it was pretty great. Labor and delivery is the bomb. If you're going to nursing school, it's something that you should look freaking forward to. So thank y'all for tuning in. I got another video coming. If you want, if you got specific questions, you can list them below, or I can go into detail. If you want to know about care plans and you're in nursing school, tune in for the next video. So thank you guys. I'm just excited to be back on freaking YouTube, y'all. I miss doing this. Like, I don't do it just, you know, for money. I do it because I like helping people and communicating with people. So thank you guys, and stay tuned for my next video, which is an old video, but y'all get the picture. So